During National Nurses Week, we celebrate the people who care for us. But it's not just about appreciation, it's about protection. Many nurses are facing a rising challenge on the job, and that's workplace violence. New research shows that it's not just impacting safety, but the entire healthcare system. Here to tell us more is Vice President and Chief Nursing Officer at Memorial Hermann The Woodlands Medical Center, John Voigt, and Senior Vice President and General Manager of Enterprise at Axon, Mike Shore. Thanks for joining us today.
Thank you.
Thank you.
So what are the healthcare leaders really dealing with when it comes to safety and security?
I think that nurses go to work every day, and again, Happy Nurses Week to my colleagues across the country. I think that they go to work with the best of intentions, trying to do the best they can in providing high quality, compassion. I think what they're encountering right now since COVID was an increase in workplace violence, something that they weren't trained for and something that they didn't expect. I think that since 2014, 2019, the number of workplace violence incidents has gone from 14,000 to 24,000 in 2023. So it's increased exponentially, but it has also become more egregious, the types of assaults that nurses are encountering. A top issue for us in nursing, and one that we feel we need to address to mitigate the burnout that's resulting from them.
And John, you do have a really unique perspective because you served in the military and in law enforcement before becoming a nurse. So how does that background really shape about how you think about safety in healthcare?
Well, I would say that as a father of 7 children, 6 girls, 3 that are in nursing, I think that's the priority for me, is to make sure that my profession doesn't cause them harm. In addition to that, I think as a military soldier, as an Army soldier, and as a police officer, I had the advantage or luxury of being trained well, and I think that training and the kind of experiences that we were taught, along with the tools that they gave us to protect ourselves, is critical. It's a vast difference from what we have in nursing. All we have in nursing is our words and our kindness, and that doesn't always alleviate the issue. I think that at the same through line for all 3 professions, everybody wants to go home at the end of their shift and then want to be with their family, and that's what we're hoping to try and improve for nurses as well.
Yeah, you mentioned that nurses, they just don't have this training. And so that is exactly why you're on our show today, to really emphasize that. So how are these incidents really showing up in staffing, turnover, and costs? And what can organizations really do to address this?
Well, as I said, I think staffing is a challenge because, the number one driver of burnout is workplace violence. And the number one, factor driving turnover is burnout. So we've got to find solutions to mitigate the burnout that's occurring. Anytime a nurse gets assaulted, that's just not one singular event. That's a cascading event that nurse deals with for the rest of their life and the rest of their career. And then the cascading effect that it has with their colleagues within their department, within the hospital, is significant. More nurses are leaving the profession because of workplace violence. More of them are retiring because of it. And the costs associated with that are pretty substantial.
So how can technology really support safety for nurses and other healthcare workers?
Sure. And that's where Axon's work around safety and security has really brought us into the healthcare system. John talks really well about what's occurring and the unfortunate normality that this is viewed with in the U.S. The fact that 2 nurses are being assaulted every hour. Axon's technology, our mission as a company is to protect life, and we build safety and security solutions that have really been adopted by the healthcare system. We're now working with over 100 hospitals. So technologies like body-worn cameras that have initially served security guards have actually been adopted by nurses. We've adapted sort of the form factor, and we think about this now as an AI-enabled wearable. So to in real time see what's going on from a security operations center, send the appropriate response, triage the incident, as well as post-event make much more efficient the reporting, both internally, externally collaborating with law enforcement I actually think a number of these stats are underreported because of the administrative burden that follows any incident. And so we're really leveling the playing field, and organizations that have adopted our solutions, such as body-worn cameras or evidence.com or real-time incident, 90%, some as high as 80 to 90%, and certainly the acuteness of those incidents has been reduced. And so in our mission is really to make these folks feel a lot safer. 1 million nurses, and every single one of those is a human being with a family. And how would you feel if you felt like you were going to be attacked at work? And we're really trying to reverse this trend.
Yeah, so if people are interested in learning more about these body cameras or just more information in general, where can people go?
.com/healthcare is a great resource for both understanding the challenge at hand as well as the solutions that are being deployed every day. And if there's one thing I want to say at the end of this interview, it's thank you to John and his colleagues for the work that you do, and happy Nurses Week.
Alrighty, thank you both so much for coming on today. We really appreciate it.